Hello everyone, I hope you are doing well. In the previous video, I had discussed about routes of drug administration where I discussed in detail the enteral route, its advantages and disadvantages. Now we move towards the parental topical and inhalation route. Before we move toward its type, we must know about the parental route. What is parental route? It's about the administration of drug other than through the digestive system is called parenteral because the drug bypass the GI tract because equipment needed for the parenteral administration includes needle, syringe, ampule or vial, solution, powders and others. Now we to move towards its type. Intramuscular. By this route, the drugs are usually given into the deltoid and gluteal muscle or buttock muscle. The absorption of the drug from these sites is rapid because of high blood circulation or these muscles have rich blood supply. The rate of absorption depends upon the concentration, solubility of the drug, and muscle blood flow. Irritant substances can be given by deep intramuscular injection and may be painful, and quinine sulfate, which is antimalarial agent, dipyron, which is analgesic and antipyretic, etc., are given by this route. What are its advantages? The absorption of the drug is quick, route of choice in emergency situation. Patient may get some psychological benefit, does not require patient cooperation. It does require medical assistance and aseptic technique. Depot preparation or slow release may be given by this route, that is, drug will release into the blood from the muscles. For example, long-acting steroids, that is dexamethasone, are given by this route in the chronic dermatitis. Long-acting penicillin, that is benzathine, are given by this route in the chronic tonsillitis, rheumatoid arthritis. Disadvantages: it is expensive route, it is painful route, it requires medical assistance, it may be danger of abscess at the site of injection. There may be the chances of the breaking of the needle into the muscle, and there may be an injury to the bones and the nerves. Now we move toward the second route, that is intravenous route. By this route, the absorption of the drug is complete. By this route, the drug are given into the veins. The drugs are directly introduced into the blood. This is the route of the choice for the aqueous preparation, not for the suspension or oily preparation, because these may block the veins. This route provides most rapid and reliable response after the administration. The effect is rapid as the drug is rapidly distributed to the tissues. Irritant drugs can be given by this infusion because these are diluted. Large volume of the drugs can be given by this route, such as plasma substitutes, blood dextrose, etc. What are its advantages? By this route, the drug produces the immediate effect. It is a route of choice in the emergency situation. Irritant drugs can be given by this route in the form of infusion, such as quinine sulfate. Large or bulk quantity of the drug can be given by this route, for example, plasma substitute. Diagnostic agent can be given by this route, for example, intravenous polography. In this case, 10 cc of the dye is given by this route to get the colored X-ray for the visualization of the kidney stone. Patient may get some psychological benefits. What are its disadvantages? It is non-economical or expensive route. It requires medical assistant or skilled person or aseptic techniques. If the drug like aminophylline is given rapidly, it will cause heart block or cardiac arrest. Aminophylline is given in the status asthmaticus because it acts as a bronchodilator. It is not suitable route for suspension or oily preparation because these block the veins and sometimes cause hemolysis. It may cause a thrombophlebitis, inflammation of vein, embolism, clot formation, and bacteremia, presence of the dead bacteria in the blood. Now we move towards the third route, that is subcutaneous route. By this route, drugs are given below or under the skin. The absorption may less than intramuscular injection. The irritant substances may cause the pain and local necrosis. Lignocaine plus adrenaline may be given by this route to produce a local anesthesia. What are its advantages? It is quick action route and produce local effect. Vaccines are given by this route and there is a uniform distribution of the drug. What are its disadvantages? It is convenient route, skilled hand person is required, maybe the formation of abscess and local necrosis of the skin, and limited route for the limited number of the drug. Now we move toward the fourth route, that is intradermal. By this route, drugs are given into the skin. Epidermis is usually punctured. This route can be used only for the immunological various skin tests or allergy tests such as penicillin. This route can be used for the diagnostic skin reactions such as tuberculin test for the tuberculosis. This is of limited therapeutic use. Now I will name some local injection which are very less commonly used route, that is intra-arterial route, intraperitoneal route, intra-articular route, intracardiac route, intrathecal route, intrapleural route. These are local route used for the administration of the drugs. Now we move towards the topical route. The drugs are given by this route to produce their local effect, particularly to the inflamed surface of the mucosal membrane. This route is applied to external surface of the skin as well as mucosal surface of the lungs, ears, and vagina. That's why it is divided into following types of administration: administration to the skin, administration to the eyes, administration to the lungs. Now we move towards the administration to the skin. Steroids, antibiotic, antiseptic, counter irritant may be applied as solution, emulsion, ointment, cream for their local action to the skin, as in the burn, eczema, dermatitis. For example, acryflavin ointments, betamethasone ointment or cream. Betamethasone and ointment and cream neomycin is used in this. Now I move towards the next route, that is inhalation route or the oral inhalation method. In this, aerosols are given by this route to produce their local effect at present time. Bronchodilators such as salbutamol inhaler may be given by this route in the asthmatic patient to produce immediate effect. Similarly, beclomethasone inhaler, beclomethasone plus salbutamol are given by this route. Here I conclude this topic. I hope you like it. For more information, like and subscribe my channel. Thank you.